Welcome back to Dr. Truong here on Net. I am Dr. Truong, as you can tell from the title screen, that I am going to do a segment about acute lymphoblastic leukemia. Now, I have a guest in the audience who is going to tell his story about how he survived and in general to help tell us about the disease. Now, let's call up Mr. William Wang. Here, wear this. You're all the guests of the show, so you will wear the lab coat. Have a seat. So tell me about yourself, Mr. Wang. How old are you?
I'm 17.
17? That's nice, that's nice. You're about to graduate, that's really nice. And so forth, where did you come from actually?
I'm from Taiwan.
Straight from Taiwan, that's you're the pure Taiwanese blood. Now, how did you actually know you had acute lymphoblastic leukemia?
Oh, well, when I was little, I have a lot of fever, and I suffer from my bones.
Yes.
And my parents know something about me, so they took me to the doctor, and the doctor ran some tests, find there's enlarged lumps, yeah, I know I got it.
It is serious. I see. Sorry. And so forth, you have to go through a lot of diagnosis, isn't that right?
Yeah.
Go through a lot of diagnosis, had to check within your blood marrows, out of bone marrows, and you had to do blood testing and all that. How did that go for you? Did you,
I was little, I was a kid, so I was much.
I see. What kind of treatments do you actually get while you were growing up?
I get chemo as well as radiation therapy when I was little. And if my oncologist, I would say if my test would get worse, I should have a bone marrow transplant, just in case.
Speaking of that, do you actually, did they ever tell you what they'll do with the bone transplant?
I already done some HLA.
Already. So they already gone through the process because, as you would already know, it goes deep into your bone, and they would give the kind of nutrition to replace everything else because you're pretty much, it's producing immature white blood cells. So in that case, you're getting the help from other people.
Yeah.
That's really nice. And so forth. That'll be it for the kind of questions we have. We're actually going to go deep into the microscopic point of view of this. We'll be right back.
The Spanish word of the day is wheelchair. There's only one donut left, so wheelchair.
We are back on the air. We are here as Dr. Truong on Net. We are going to look deep within this disease called acute lymphoblastic leukemia. Now, moving on to the first slide. What is lymphoblastic leukemia? Well, first to give you an introduction, these are the white blood cells. As you can see here, these are the normal ones that you see. Like any other cell, it has a nucleus inside. Showing that it has grown, mature, more or less like a metaphor of saying like they've grown, they know what they're doing. Now, take note of how they look like a normal cell, just the nucleus inside. Now we look at what is the disease look like. Here are what it will look like for the cells because as the description will say, these are immature white blood cells. Yes, these are blood cells, but these are immature. As you can tell, they do not have a nucleus in any one of these. Metaphorically saying like children have not had anything developed at all. Sounds like a sad story. Well, that is pretty much life in a sad way. Now, how do we know how it works within it internally? How do you know what it'll actually look like? Well, we have a visual for that right here for you. We will go deep within the bone where it's actually made for most of these cells. Specifically, with the stem cell here, it creates 3 cells. The red blood cell, the white blood cell, and the platelets. Now, what are these exactly? The red blood cells are there to transport your oxygen nutrients. The white blood cells are there to fight off your infections of anything inside. And the platelets are there to help with any clotting of the blood. Now, what will happen with this disease? Well, take a look outside. This is what the cells will look like. Now, with the term acute, it means it will spread rapidly and fast. And as you can tell with all of them, spreading really fast, making thick, making a lot of itself fast like mitosis. But so forth, they create themselves and it's made within it because the younger children are really prone to have something like that. With the normal white blood cells around, these are the replacements. They go inside your bloodstreams like a white blood cell, and they go throughout your body like a normal cell. But they're not a good one, so you get malnutrition and you get sick easily. The symptoms would include persistent fever, fatigue, bleeding, ease bruising, and swollen lymph nodes. Getting treatments like an injection right here will go into your bloodstream because it will most likely eliminate most of the cells. You have chemoradiation and injections into what you'll see here goes inside of your bones. It has to go deep to know. It's most common cancer for young children, as Mr. Wang is. Nearly 80% of them can all be cured, as you saw with William, alive and well. And that is it for today. We will come back next time with something much greater. Have a nice day, everyone.
Take a deep breath, deep breath, deep breath, deep breath. Let it go, let it out, let it go, let it out. Take a deep breath, deep breath, deep breath. Feel the frost and touch the sky. Take a deep breath, deep breath, deep breath, deep breath. Let it go, let it out, let it go, let it out. Take a deep breath, deep breath, deep breath. Till you feel the frost and touch the sky. On a sunny morning I touch the sky. Next morning I touched your heart. What's the start? I play my role when I rip the mic apart. Do what I got to do to place a spark. I'ma put it down, seeking no crown anymore. From the moment I saw you, it's all gone. Hard to believe to a pimp like me. Used to have 7 women every day of the week.